Happy Tuesday. I'm Dr. Roney, and we're here with Dr. Rowe.
Hi.
Special guest for us tonight to do a lot of the Q&A. So we're happy to have you, Dr. Rowe.
Thank
Pleasure.
you.
And if you're here consistently, and a lot of you are, I just want to take the opportunity to welcome you back. And if you're new to the cancer conversation, I want to take the opportunity to welcome you as well. You know, you hear me say this all the time, and Dr. Rowe and I talk about this in meetings, but the whole idea here with this cancer conversation, if you're new to it, is to make sure that we're teaching, right, and allowing you to understand information that needs to be understood, right? It needs to get out there. So we look at this as a movement. We want to give you the information, and so you can help people that you know in your, whether it's a family member or friends. And you'll see this a lot, right? Once you start understanding this a little bit better, you'll get excited, I guess, a bit passionate about it, and then you'll get this, you'll feel this injustice that's being done, right? And with that, you'll want to share the story because you know it can help people. And that's the idea. So the cancer conversation, if you're new to it, is designed to just help you as much as possible, that if you yourself or friends or family are going through this and or want to prevent it and or prevent reoccurrence from happening, you have at least the tools in the toolbox to do it and the knowledge to make an informed decision. So I had a patient that I just went over. He's a new patient today, 46-year-old male, colorectal cancer, and kind of, I think, not super sure about, you know, the whole process. I think if I'm not mistaken, his wife was probably the catalyst for him coming in. And
Usually is.
Yeah, right. We need that. Yeah. We know that. So as I went through the plan, and the 4 pillars is what I like to go through. And I'll do that in a second. And I'll do it somewhat quicker because I know a lot of you that have been on here week to week understand it real well. But I really like to do it for the people that are joining us for the first time because it sets a foundation. And a lot of the questions that are asked week to week on the Q&As, really we can revert back to the 4 pillars. And at least if you have that understanding, the questions are much easier, I think, to understand.
And repetition is key.
No.
I love that you go over it every time.
I know. I know some are probably tired of hearing it. I get it. I understand that.
Yeah,
but it is key.
It just drills it in, and we actually end up remembering.
Yeah, very, very true. And I think it's so important because when I'm downstairs working in the beginning, one of my roles in the clinic is after their initial consult, I meet with them because I want to make sure that they understand it, it's digestible, because a lot's thrown at them quickly, as you know, right? And so if they understand the foundation, and not necessarily all the details right away, but at least the method to the madness.
Why we're doing what we're doing.
Exactly. And then they learn. It's almost like day one of high school. So with that, the whole 4 pillars and the approach, the better they understand it, there's a sense of peace that starts coming over them, where they're like, I get it. I understand why they're throwing all this at me and what testing we're doing and why we're doing the testing and what pillar 2 and the starve and the kill phase and so forth, which I'll go over briefly. But then again, I think with information and understanding, there becomes a level of like, you see their shoulders just kind of relax a little bit and they go, okay, they've got it. I can just come, I could show up, I can heal, and I know that they have the I's dotted and T's crossed. And that's what I like to do that's part of my role within the clinic. I'm good with pillar 4, which is a lot of the functional med causes and the testing and how to clean a lot of that up. And that's part of my role, but I love the role of kind of quarterbacking everything. I think it's a good thing and for y'all to have. So, but the plan is the big part of this. So let's talk briefly about the 4 pillars. The first part is going to be the testing, right? So of course there's blood work that is done in the conventional world, and there are scans that are done in the conventional world, and we do those as well. The additional tests that we want to do to collect more data points, if you will, is going to be circulating tumor cell activity is a big one. There are more and more companies out there now that are doing this testing. So we have probably a good, I'm going to say about 5 to 7 companies that we really rely on. We could do Signatera, Guardant, RGCC, Datar is a new one that we picked up, Fulgent. There's a number of different labs that we may use, and it's the doctor's preference, and it's based on what cancer you have and so forth. So the point I'll make is those circulating tumor cells are cells that are basically cleaved off the original tumor and circulating around the bloodstream that those tests help identify. So if we don't know that they're there, and say you get to a point of no evidence of disease, but those aren't addressed, the reoccurrence rate goes higher.
Right.
So we want to use that also as a good surveillance tool. And then if we get into things like nagalase and PHI and D-dimer, these are other markers in addition to if there's breast cancer, we're looking at CA15-3 and CA27-29. If it's, if we're looking at the 19-9s for pancreatic or CA125, CEA, LDH, there's a lot of them. The point I'm making is with a lot of these data points, we need to know those if they're going on now. And I'll use an example like nagalase. It's an enzyme that's secreted by the cancer cell that blocks the immune system from identifying the cancer cell. It's a good test to have today so we can do things to lower the nagalase levels, right? Which gives your immune system a better chance. But long term, it's part of the surveillance now. So now if we're doing all these tumor markers and say you're circulating tumor cell activity and we're doing nagalase and PHI and D-dimer and scans and full body scans and all these different things, we're not going to miss. So if something starts to come back, we're not gonna miss it much, right? We're gonna get it very early in the process. So I think personally, for me, with my history, doing those tests, it gives me a sense of peace. Like I know I'm on it. Whereas before I had no plan and I didn't have any of these tests to do. I'm just like I'm hoping and praying.
Well, no one offered anything.
That's exactly right.
Yeah.
That's exactly right. So it's almost. I almost give you my experience because of the peace and sanity that it's created by having all these different data points now. So, and that goes for if you're thinking about, hey, early detection or you're on the wellness side. All these tests can be done if you've never had cancer and you're like, hey, let me make sure. I mean, gosh, there's those tests, there's the Gallery test, there's a bunch of different things now that can be done that basically can check off a lot of check the dots, if you will, or check the boxes. Sorry. So
it's preemptive in terms of screening, all of that.
It is, and it's. I think today's world, we say it all the time. Over the last few years, things have just really gotten
so much more available and a lot more coming.
Which is great. And again, that's from a testing standpoint, that's our pillar one. It's the testing. And I think we do a really, really good job to the point where I'm kind of a hard judge because I feel like my standards high. And I feel comfortable with it. That's I don't mean to be arrogant, but I feel like, with learning over the years, it's like I feel comfortable with my history that these tests really are good. And if somebody calls me, and you know this, you have family members or friends that know what you do now, so you're getting calls constantly. I feel comfortable letting them know, hey, if you do these things, you're going to be good. And I feel like from a reputation standpoint, there's trust there, right?
Does everybody here know about your history?
I tell it a lot. So back in the day, this was at 28. I got diagnosed with a melanoma. I try to tell the patients so it's a little relatable, and they got it early, which was great. I tell the story. My wife made the appointment. Speaking of wife, right? She makes the appointment. She's like, I don't like that spot on your back. And I'm like, no, it's fine. I feel great. Whatever. So she calls me that morning and she says, you have your appointment at 11. And I'll never forget this. I said, you know what? I'm so busy. I'm going to reschedule. She goes, you reschedule it and I'm not going to be here when you get home. Ooh. I'm like, fine.
Wow.
Fine. I'll go. There was some half-hearted, but I know there was. I knew what she meant.
Yeah.
And
she was serious.
She was serious. And I went and it turned out to be cancerous. So she's always right. That's the I don't know how it happens, but always right. But nonetheless, they got it early. There was clear margins, but that was it. Meaning, so after that, I tell that story of I'm in this invincible stage. I'm 28, come out of college, college athlete. Like I'm working out. I feel invincible.
Yeah.
You get that diagnosis, and when there's no plan and no testing, and it's more like, hey, we'll come back in a year and we'll check everything out.
Just look at everything, your skin.
Yeah, every little bump and bruise.
Paranoia.
Oh my gosh,
Yeah.
every lymph node that's like, oh, is this something?
Yeah.
So. And if you're going through this, you know what I mean. And so the point I'll make with that is, with this testing that I just laid out and the tools that we have here that I'll go through in a second with the 4 pillars, I literally have zero anxiety or fear.
Thank God.
And before it was just hope and pray. And I knew it wasn't enough, but I just didn't know enough other than the health regimen that I was doing. But it obviously didn't work because I got it.
It happened.
Right?
Yeah,
So, and then there's a history. My father passed away that same year. His father passed away 2 years before that. 2 of my uncles passed away. So it's like, there's definitely something. So then it prompted me as not only a clinician, but as a patient to go down that road. So when I say I feel comfortable, I don't mean it arrogantly. I mean it, hey, I feel comfortable as a patient with all these different tests and as a clinician. So it's a good story. I tell it sometimes, I don't know if everybody knows it, but
no, that's great.
But it takes one to know one.
Yes.
So
yes.
That's how I can relate very well to the patients coming in. I know what they're going through because I've been through it.
Yep.
And somebody that didn't worry much at all. And I became ooh.
You became, I mean, it's your health. And it could have been something that caused something horrible to happen.
Right.
If you let it go. Yeah.
Exactly. So that the testing is a big part of it. Pillar 2, and I'll go through these somewhat briefly, is going to be the starving of the cancer and the killing of the cancer. So the starve phase is going to be your repurposed medications or off-label drugs, they call them. And these are drugs that help block the pathways, keeping it simple, that will feed the cancer cells. It could be metformin. The fenbendazole protocol is very big nowadays. Menbendazole, some of the antiparasitics. It could be some of the antibiotics or statins or so forth. The point I'll make is some of those drugs are proven to block the pathways that feed cancer.
Yeah.
That's part of the starve phase. The other part is that Dr. Seafried, who was on a couple months ago, talked about starving with pushing on the glutamine and pushing on the glucose and pulsing the glutamine and knocking the fuel source of the cancer down. So if you're starving and then you're knocking down, you're basically dropping, again, the feeding of it, which in his words, he feels like it slows the process down dramatically. No cure, right? Although he's seen some things, but nobody's going to say cure. But it knocks down the feeding of it, so it at least slows it down so the body has a better chance. And I think that's an imperative step in the process. The kill phase is going to be your chemos, your surgeries, your radiations, your immunotherapies. Here we do low-dose chemo. But it also could be, and I call those the atomic bombs, or the bombs.
Yeah.
But it also could be the grenades, which I consider to be high-dose vitamin C, and maybe hyperthermia, and some of these other natural remedies that have been shown to be able to create a cytotoxic effect, right?
Right.
The caveat to what to use is going to be, are the natural remedies enough ammunition to do the job? Though that's the caveat, right? So is hyperthermia plus vitamin C plus artesunate plus some of these other things enough? And I mean, it's probably been our experience that probably not with a lot of people, right? If not most.
Right.
I say it all the time. I said, look, we're conservative, but we're not naive. And, I think the exception is that cancer could be healed naturally, but I think the rule is it's going to probably need a little bit more oomph.
Combination.
And that's the marriage of the integrative model.
Yeah.
So when we're looking at, starving and killing, it gives you an idea, right, of those. And then we get into the hallmarks of cancer, the cellular, what happens to the environment. Number one, weakened immune system. So we want to strengthen the immune system. This is our pillar 3, by the way. Number 2, we want to oxygenate the tissues and the cells. Low oxygen, high acidity, hallmark of cancer cells. So oxygenating, lower the acidity, increase the alkalinity. Charging the cell, Dr. Tennant's research shows that the cellular energy, if you will, starts to decrease. and that's indicative of a diseased cell, which it can't heal well under those circumstances. So charging, we have the biocharger, the biomodulator. That's why we use those things. If you're home, ground. Get on the ground, get your shoes off, go to the beach, on the sand, go in the grass. All those things are going to help charge. And then the trace minerals and your vitamin levels are adequate because they're going to provide the mitochondria, which keeps that cell strong and producing what they call ATP, very healthy and strong. So point with that is start with the cell to change the cellular environment by increasing the immune system, by oxygenating, alkalizing, charging, and then getting that intracellular nutrition really, really high. That's going to change the environment that's conducive for cancer. So we go out of the gate really quickly with that with most patients that come here, right? That's our kind of our staple.
Yeah.
And then finally, the causes, right? There has to be reasons why this happened in the first place. And typically we're going to see your pathogens, right? It could be everything from bacteria and viral loads. It could be candida and mycotoxins, which are fungi. It could be parasites, metals, toxins. It could be the foods that we're eating creating this inflammatory response. It could be poor gut health. It could be poor detox. The list actually goes on. It could be stress. It could be poor sleep, poor water, EMFs. The list goes on. The point I'm making is it's not just bad luck, right? It's not just happenstance. There are physiological, biochemical, and metabolic reasons why this cell that I just explained, why it becomes damaged. And when it becomes damaged, especially the DNA and the genomes, those structures that take the cell through cell death, which is apoptosis, if there's enough inflammation, oxidative stress, and damage to those structures, that cell starts to replicate out of control as opposed to go through cell death. So there are reasons for all this, right? So we want to make sure that we break down as many of those as we can with a checklist, and that's what I like to do. I like to create a checklist for the patients and make sure we're dotting those I's and crossing those T's. So with that gives you an idea if you test it right, if you starve it, if you pick the right killing modalities, you start changing the cellular environment, and you can find and fix the causes, you give yourself the best chance, right? That's the bottom line, gang. Nothing's ever guaranteed, but like I tell my kids all the time, with a plan, you may lose some battles, but you should win the war. And we're looking at putting the best plan together to win the war. Either prevention, so it never happens, or while you're going through it, so we get no evidence of disease and it doesn't reoccur, or you've had cancer and you want to prevent reoccurrence. Either one of those, that 4-pillar plan is the plan. That gives a good foundation, gang, for what the questions will probably be, and then we'll relate it back to that 4-pillar approach, okay? So hopefully that makes some sense. So let me share the screen. We go over all the time. This is up a lot, so you all know my background. But Dr. Rowe, if you don't mind, go ahead and give a little CV.
Got my Bachelor of Arts at Pomona College in neuroscience, and then I went to medical school at Western University in Pomona. I completed my family medicine residency at Glendale Adventist. It was an unopposed program, so we were the only residents in the hospital. So I think that gave us a really good training foundation. So it was really great. And I've been board certified in that since 2007. I've worked in a lot of different conventional allopathic settings. But I've always had my interest in alternative medicine because I became a patient back when I was in college of my aunt who is an OB-GYN, who does integrative medicine. So she's dual boarded in integrative medicine as well as OB-GYN.
That's cool.
Yeah. And I was doing rotations with her as a student. So before I went to pre-med stuff, then I went to medical school. I did rotations every time I was in a different school. And so I had the benefit of learning from her, but I became her patient because when I was seeing her patients, I realized, hey, I have that. And she's like, well, you need to do this, this, and this. And so she had a 6-month wait list in Colorado for new patients. And she was great, and she still is there. I just am here.
So she took them on as a patient using the conventional model if needed, and but then talked about causes.
Yeah, she did surgeries.
Yeah, right.
She did everything that a traditional GYN would do, an OB-GYN would do. She delivered babies. Yeah. But on top of that, she worked on a lot of nutritional things with patients. Yeah. Did a lot of bioenergetic testing like we do. So that's how I know about the biomeridian, which Molly uses for the bioimmune here. Yeah.
That'd be great if it's the norm. Sorry to interrupt.
No, I know.
If that was the norm with every healthcare provider, but go ahead, sorry.
Yeah, no, that's fine. You can interrupt anytime. So that's how I got interested in bioenergetic testing. And we have 4 or 5 different machines here that do pretty much the same thing, but it's looking at root cause, because it's finding things that are not found on urine, blood, and stool tests. So that's why the bioenergetic testing is so, I love it. And it just gives us so much more information about hidden things in our bodies. I've worked at Kaiser. I've worked at a big facility in Whittier at PIH Health. I've worked in a small group practice. I've worked in concierge medicine for seniors, going to assisted living facilities and homes. All the while kind of incorporating the integrative things and supplements and things. So, sorry, it sounds like you can't hear me too well, so I'm going to move the mic over.
Yeah, that's perfect.
So what brought me here is the amazing things that are available all under one roof in Dr. Keneally's office. And, I think it's just a gift because there's really nowhere like it. Right? So,
when you were practicing, right, when you learn the integrative model and then you're practicing, do you feel like when you were practicing, say Kaiser or wherever, especially with your background with your aunt, was your aunt, right?
Yeah, my aunt.
Yeah, you've got to be thinking subconsciously like, right?
I mean, so there were things where I don't want to knock on other institutions.
There's definitely a need and a place, and we talk about it all the time. But it's really one chapter of potentially a 10 or 20 chapter book.
Yeah. So it was frustrating because you would see patients and you knew there was a good alternative, but that's not what they wanted you to do. Right. You basically had to follow their algorithms to do what they want, and if you didn't give a certain prescription medication for a certain diagnosis, then you got dinged. Yeah, right. And you would lose your bonus, for instance.
Yeah, that's ridiculous.
Yeah, it's crazy.
That's
so
biased.
they want to get certain benchmarks hit.
Yep.
And there wasn't really much choice for patients, which I did not care for at all. And so it was hard. It's hard knowing what you know outside of conventional medicine that you weren't able to incorporate that into the normal, hospital or office setting.
Once you turn that page, it's hard to.
You can't go back. You can't go back if you're enlightened.
Yeah, well, even as a patient, the patients tell me that too. It's like, but then we had to. I think rationalize a little bit as far as how we're going to use the systems appropriately, and that's where there is incredible respect for. Especially in the cancer world, for the healthcare system that's providing some of the things that I think are needed right now. Now, hopefully that changes where we can make these things obsolete, these atomic bombs, if you will. But right now, it's kind of a necessary evil. And so we respect it. It's like, okay, I'm going into that system, I'm going to respect it, I'm going to do what I need to do. But then again, not to be redundant, but spend the other time, energy, and money on the other 9 chapters or other 19 chapters of the 20 chapter book, if you will. Right. And to your point, right, that's the marrying of the two that I would assume here, like you feel much better about yourself almost on like it resonates better.
Yeah, I'm working with truth.
Truth, yeah, no, right. Love it.
It's truth, and it's something that, other people ignore, unfortunately. And there are people in the profession who really want to ignore the benefits of a lot of what we do. So my experience with cancer comes from my mother-in-law first, who back in 2005 was diagnosed with cholangiocarcinoma. And she went to, I'm going to name the names, UCLA, USC, Loma Linda, Stanford, all the big name hospitals. She talked to everyone she could possibly talk to, and everyone told her at the end, Stanford told her, take a nice 4-month vacation and say goodbye to everybody.
Wow. Right.
She's still alive today. She was diagnosed in 2005. Cholangio is a really bad cancer.
Right, sure.
Because once they find it, you usually have micrometastasis. And she did. The year after her gallbladder and liver, 2/3 of her liver were taken out, it came back to the liver. She had to get radiotherapy there. Then the year after that, it spread to her lung. She had to get a lobe of her lung cut out. And then a year after that, it came back to another lung.
Wow.
So she's had 9 cancer surgeries since the diagnosis.
Wow.
But early on, we got her on some of the things we're going to talk about, because I saw some questions about proteolytic enzymes and systemic enzymes.
Yeah.
We got her on different supports for her digestion and her gut.
Yep.
She's still working on parasites today,
Mm-hmm.
because those come and go, unfortunately. So we did a lot of alternative on top of her getting the surgeries, on top of her getting chemo, although the chemo, really everyone told her nothing was going to work. That was the sickest she ever was when she was on chemo, 3 different rounds.
Yep.
And she changed her life. She started juicing. You know, it is her second full-time job.
Sure.
So, and that's true for all of our cancer patients. This is a full-time job.
It is.
To stay healthy, to be healthy and stay healthy.
Mm-hmm.
So I applaud everyone who's trying to do this, who's trying to work on themselves, and who's trying to do anything beyond the conventional, because it takes so much work and time and effort, resources, support from family, because this is very difficult.
Yeah, so the time, energy, and money part of it is, you know, we always talk about if it's possible to look at it from an investment standpoint, whether that's here or somewhere else, gang.
Right.
But the investment of time, the investment for that outcome.
Yep.
And, you know, unfortunately, you know, we've been taught even growing up, it's more of a passive type of paradigm where go to the doctor, they're like, here, take this, you go home, and that's it. You know, it's passive, and it's still passive. This is active. You've got to literally, you know, implement. I mean, we might be the navigation, if you will, but you're driving the bus.
Right.
You know, and that we know that's not easy. But so it takes that commitment, and it takes the time, and it takes the energy, you know, and the money, and all of it. And we totally get that. So great point. It's like you just being on here for this learning. Yeah. That's what it's all about. Yeah. It's like, hey, let's learn.
Yeah. It takes commitment.
Yeah.
Yeah.
Yeah. Awesome.
Yeah.
Awesome.
So then there's a couple more things in the family.
Go ahead.
So then my dad, he had a massive hemorrhagic stroke in 2013.
Right, I remember you telling me that.
Yeah, and then he miraculously survived that. So that's a whole different story. A second, same spot, hemorrhagic stroke at the brainstem, which they said he was going to be brain dead, and he survived it. But 2 weeks after my dad was in the ICU for that second stroke, my mom was diagnosed with lung cancer.
Wow.
So my mom had lung cancer. We went through all of the treatment with that. She did have surgery. She did have chemo. But thank God she had the gene mutation EGFR, so that Tagrisso, which is a drug, a chemo drug, basically immunotherapy drug that targets that gene, is keeping her alive.
Yeah,
so she's living with stage 4 lung cancer because the next year, before she was eligible to take the Tagrisso, it had to go somewhere else. It had to be a stage 4 diagnosis.
Oh,
so it went to her brain,
right. Yeah. Oh my gosh.
and then they said, "Oh yeah, you could take the Tagrisso," even though we knew it was going to work for her before that. Okay. So she has lung cancer stage
like
4. No, so apparently they have started changing that.
Yeah,
but,
I mean, my goodness.
Yeah, but not everywhere. And then, so she has stage 4. My dad, unfortunately, while he was in the nursing home, long-term care, because of the second stroke, he kept getting UTIs, and no one. And you know, I feel a bit of guilt over this too, but no one ever checked, even though he had a cystoscopy that was normal. So I thought he was okay. No one ever checked again to see that he had bladder cancer.
Oh, geez.
So he passed with bladder cancer just before COVID in 2019.
Oh.
So that was my experience with cancer and being on the patient side, because I was their patient advocate and
so
caregiver.
You went down even the rabbit holes to on your own, even without, you know, a lot of this. Yes, there's books and there's teachings and there's classes, but I'm telling you, a lot of this you learn as an advocate or a patient yourself, or whatever, and you
Yeah.
just keep going and going. And the good thing for us, we have resources that we can go to as opposed to just Google,
Right.
you know, which is great. That's why I
Right.
love being here. We
Yeah.
have these, you know, access to research, and we have access to some of the brightest minds in integrative oncology or integrative medicine that we can utilize too. So we're lucky in that regard for sure. So a lot of personal history, right? Which I think it takes one to know one.
Right.
Even when we hire, I asked them, look, you know, have you ever had a personal experience with this? Because I think it matters.
Yeah.
You know, with empathy.
Yeah.
You know, and then it's more than a job. It's people that really want to make a difference because they've been through it, and it's tough. It stinks. You know. So anyway, all right. So the center, we talk about that all the time as far as where we are.
Yeah.
I'll go through some of the wellness things that we do now. I think that's a huge thing over the last couple years. It's my kind of what I'm working on and pushing and emphasizing is let's get you in on the front end, and let's make sure we're doing a lot of these tests, you know, these early detection tests, and then we're doing a lot of the cause testing. And the light went on probably with COVID. Honestly, like, wow, I have to do more, meaning I have to look deeper. Even though I feel well, I feel healthy, I've done a lot of things. I just think it's time for everybody to take that next step of some of the things that could create wellness. So we'll talk about that a little bit. Okay, so Q&A, let's start. So the best way to prevent cancer reoccurrence, phenomenal, leads us right in. So honestly, the 4 pillars is the way.
That's the key.
It's the key. So if we do the right testing, right, surveillance.
Yes.
So you get on your surveillance routine of, say, every, you know, some are going to be every, say, 2 months. It depends. It depends on where you're at in the stage. But say some are every, say, month to 2 months, then some are every 3 months, some are every 6 months. But the point I'll make is if we have, say, 10 data points that we're looking at, plus mix in scans and things like that at certain intervals, we're not going to miss much on the surveillance side. I love that part. The second part is to make sure that we are working on the cell.
Okay. Yeah.
We're changing cellular health. So we are oxygenating, we're alkalizing, we're immune boosting, right? We are working on the nutrition of the cell. We're detoxing, we're lymph drainage. You know, we're doing these things that are going to create, you know, an environment that's harder for cancer to thrive. And that even goes into, and this is a lot, but that goes into how fasting can help, whether it's intermittent fasting or some prolonged fast, or your heat, like your infrared saunas,
Red light,
increasing what they call heat shock proteins, or your cold and what that does to the human body and the cell. It starts to protect it more and more. And so the cellular health is significant for reoccurrence. And then you get into the causes, I think, are critical. We have to then go down that path, create the checklist, which I think now for me, what I go over the page, it's like 25 things long. Now they're not all, you know, really aggressive, but there are things that are on that checklist that we want to make sure that if you're getting an inflammatory response, we figure out why. If you're having stress and a cortisol response and hormonal imbalances, we look at that. If you're having overexposure to EMFs, if you're not detoxing well, I mean, we're getting heavily into methylation and epigenetic factors, which I think every patient should be tested for across the board because they're so prevalent now. We'll do a whole separate, cancer class on that or cancer conversation. But I mean, the reoccurrence part, that's how you do it. You do your early detection, surveillance, and then you work on the cell health, and then you work on the causes. Anything to add to that, Doc? That's pretty...
I was just thinking, starting with the basics,
No doubt.
Literally diet, exercise, healthy weight, avoiding alcohol, tobacco. I mean, that's like super, super basic.
Processed foods.
But some people don't even do that.
No, right. Yeah, true.
So,
right.
I mean, it kind of has to start with that because you can dump everything else on top of that if you don't have that strong foundation.
Good point.
It's really hard to better.
Yeah, it's like
improve.
a pyramid.
Yeah.
The pyramid is the foundation.
Yeah.
And then you can work your way up to the next easier stuff or harder stuff and then the really hard stuff.
Yeah.
But that's a great point.
Stress management, mental health, all of that on top of all it. There's just so much.
Yeah.
I mean, there are too many ways to attack this.
Yep.
Yeah.
Yep. But yeah, your the reoccurrence is definitely, there's a plan, and that's where sometimes you'll need, whether it's our clinic or another clinic or healthcare providers that can at least help guide you and walk you through that process. And that's one of the things that we promote significantly here. But I mean, there's other places that do it.
Yeah.
But I think we just do a really good job.
It's really hard to do it yourself. You really need help.
I think it's almost
you really
impossible,
need
to be honest
Yeah,
with you.
you need to talk to somebody.
Okay, so the Cancer Revolution, Dr. Keneally suggests the Udo's 369 oil, but it has seed oils in it. Are these seed oils safe? Why not, right?
So,
Yeah.
Dr. Keneally is actually doing a revision of the book.
Yep.
So whoever caught this, good job.
Yep.
You're right that the sunflower oil, so in the Udos, I believe there's flaxseed oil, sunflower oil, and sesame oil. So flax and sesame are not so bad. I mean, we eat those things. But the sunflower is possibly a problem. So it can be inflammatory. And so that is a no-no. So she is working on a new revision on the book, or actually, is it a whole new book?
Kind of revision.
Okay. And so science changes. And that's one thing that we know that needs to be updated. So good catch on that one.
Yeah, and I'll add to it a little bit, because I did my research on this a couple years ago, and even the last year, and specifically on the Udos. And I will tell you that seed oils aren't as bad as they are projected, and I'm going to tell you what happens with them. They are if there is a lot of oxidative stress or oxidation, meaning if they're exposed to light or heat or oxygen, right? So the way that they do it, the Udos does it, is they don't expose the seeds at all, ever, to any one of those three. So the processing of it is typically the problem. Of those oils are the problem, and the oxidation that occurs, and then that changes the biochemistry of it.
Right.
Then the second part is how they're used, right? So they're usually processed, they're used in cooking. That definitely is damaging. So the point I'll make is, if the start to finish process is good, typically the oil is actually, oils can be very healthy.
Yes.
And in the right, I'll say ratio, because typically the omega-3s are going to be anti-inflammatory. 6 and 9s could be pro-inflammatory if they're out of ratio. And the Udos does, I think, a good job of keeping the ratio, and then making sure that the way they take the seeds from start to finish are not exposed to light, heat, or light, heat, or oxygen, which creates the damage to them and change the molecular structure. So there could be some good things with that, for sure. But again, the seed oils can be a problem, don't get me wrong. And the way they're usually done, they are a problem. So that gives a little bit, I think, maybe deeper insight to that question. So do your due diligence, whatever company you're using from a seed oil standpoint, they can be okay, unless they're the way they're manufactured, if you will, or processed and or used by you. That's where the damage comes in.
So what you're saying is that this is a more balanced blend.
Yeah.
Because some people still need omega-6s.
No,
And
exactly.
that can have some really good health benefits too.
Exactly.
But in general, it's cold pressed too.
That's
so
exactly
that's a good
right.
one.
Yeah, they when I did the research, and this Udo is the guy's first name. I don't remember the last name, but so it's named Udos. But he, just like when I was reading this about, and this wasn't too long ago, after Dr. Seyfried was on, Dr. Seyfried said, hey, there's very few scientific literate people. I felt like this person understood, why the seed oils are bad, and then worked to make sure that if he's putting them in there, it's getting the best of those. And that's, I felt like his research was really, really strong, as opposed to just saying, hey, they might be bad. They could be, but getting a deeper dive. So I'm pretty good with this one.
Okay.
But again, we'll see what the revised version is. But I would use that platform to do your research.
Yeah.
Yeah.
And so let's talk about what the actual bad seed oils are.
Yeah, go ahead.
The inflammatory ones would be canola, vegetable corn oil,
Definitely.
cottonseed, safflower, soybean, grapeseed. Those tend to be the known bad seed oils because they're pro-inflammatory.
Yep.
And highly refined, a lot of trans fats,
yes,
oxidation products like you mentioned.
Yeah.
You're right on.
It's really how it's processed and manufactured, and most of the time, most of these companies do it, unfortunately, not well.
Yeah.
And then the end product can be very pro-inflammatory and just not good for
and
the
there's
body.
a website you can look up called Raypeat, RAYPEAT.com. It talks all about toxic cooking oils, so you can look at that.
Yeah. Good question though. Good question. All right. Are there any helpful suggestions to relieving neuropathy symptoms for chemo? Yeah, actually, there's quite a few. But do you have?
I know our low dose chemo group downstairs. They actually like to do IV EDTA chelation for people who do not have any heavy metals in their teeth.
Right.
Okay, so that actually helps their patients with the neuropathy post chemo.
And they do the PK HEPAR push.
Yeah, they do do liver support IV as well. We should be checking B vitamins to make sure you have enough, because B vitamin deficiency exacerbates any neuropathic pain.
Yep.
So ALA is really good, which is alpha lipoic acid or R-lipoic acid. Omegas help. Acetyl L-carnitine also helps. Then some other things that we could go to if it's severe, we could even do some peptides. There's BPC, there's thymosin. So you would talk to your provider to find out what would work or help you. But there are a number of options in terms of how to relieve the neuropathy. We have Scanner here, which is one of my favorite modalities. It is another all-in-one type of modality to me. That we have helped people with neuropathy for years, chronic neuropathy, and people are getting feeling back in their feet. Yeah. Which, I mean, no one has that in terms of treatment outside of something like Scanner in here.
Agreed.
What else? I think that's good. We also have some whole food supports that help with nerves, like neurotropin from Standard Process. Sometimes you can do a short burst of the glutamine for about 3 days after chemo, and that may help. But that's something that's going to come up. Someone asked about amino acids, and glutamine's not one that we want to stay on long term. So.
Yeah, for sure.
Anyway.
For sure. Yeah, and I'll add a quick antidote. So one of the things that's understood, not by many, but it understood that the chemo itself, they use a term called a half-life. So every couple hours in the body, the chemo reduces its effectiveness in the body, right? So after a certain time, sometimes it's as short as 12 hours, maybe 24 to 48 tops, these chemo agents are no longer effective in the body. So once we know, and we can research that, meaning we could say, oh, you're on this chemo agent, it'll be, the half-life is done in, say, 12 hours. Once that half-life is done, or say 24, whatever it might be, then we could start flushing. We could start doing the HEPAR PK push. We could do the EDTA chelation, because it's proven it's no longer effective, but the toxins are still there. So then we want to get right on being able to clear those from the body using some of the techniques, plus supporting, with the B vitamins, the magnesiums, the alpha lipoic acid, things that are going to help the cell. Even, nitric oxide boosters tend to work really well, because anytime there's a nerve, there's a vein and an artery, and we want to make sure we're getting plenty of peripheral circulation there and oxygen. So all those different things are really helpful. But I thought it was important, not many people know that. I don't even know if you're doing conventional chemo, they would even recognize it. I have no idea. But it is a true fact. So anyway, we can use that to your advantage to lower the neuropathy incidence. Hydrogen water at all times or just occasionally? What are the health benefits? Also, what home water filtration system do you recommend? Yeah, I mean, go ahead.
So I don't think it would be a bad idea if you can afford it.
Sure. Agreed.
Hydrogen water can be very expensive, but there are quite a few health benefits. It's an antioxidant. It reduces inflammation. It takes care of oxidative stress, stimulates healing. It can improve, some people tout that it improves athletic performance and overall well-being. So it's a good one to drink. Do you have to drink it all the time? You don't. have to, because hydrating in general is a good thing.
Sure.
With any water.
Yes.
As long as it's clean and filtered.
Yep.
And most people don't do that well enough.
Mm-hmm.
But yeah, so it would be a good idea. And there are other water alternatives that we like as well. Hydrogen water is great.
Yeah.
We have Izumio in our store in little pouches from Japan. They do a lot of research and it has high hydrogen content. We have, sorry, I'm just coughing on my
no worries.
own spit.
No, you're good. You're good. Take a second.
We like Berkey